Hello guys, how are you all? Today we will discuss AMC Part 1 recall question from Gynae section. So let's start the question discussion. Question number 1. A 34-year-old Aboriginal woman is found to be IgM positive. IgM means active infection. So she is found to be IgM positive but IgG negative after exposure to a child with rubella during the first trimester of pregnancy. Rubella infection is confirmed with repeated serology testing showing not only a positive IgM but also the rising titers of IgG. Which one of the following would be the most appropriate next step in the management? A. Termination of pregnancy. B. Give natural human immunoglobulin NHIG. C. Check rubella serology again and get the test reported from the another laboratory. D. No action is required. E. Give MMR vaccine. So, MMR is actually a live vaccine and it is contraindicated in pregnancy, so it should not be given in pregnancy. So this is the clear cut the wrong option. No action is required. We have to do some action because she is having acute infection. Check rubella serology again and get the test reported from the another laboratory. They have already done this with repeated serology. They have seen that IgG titers is rising. So this is again not required. Give natural human immunoglobulin is also the wrong answer. The correct answer here is because she is rubella, suffering from the rubella, and rubella has so many complications during the first trimester of the pregnancy. So the termination of the pregnancy is required. Correct answer is A. Let's see the explanation for this question. You can see proper question here again. So the explanation is the positive IgM for rubella indicate active rubella infection. In such cases, repeat the test is indicated. If IgM is still positive, diagnosis of rubella infection is confirmed. No further testing from another laboratory is required. So here we can see in the question that already rubella infection is confirmed with repeated serology. So once it is confirmed from the another test, no further testing from another laboratory is required. If rubella infection occurred in the first trimester of pregnancy, the risk of fetal infection and damage is very high. It is 85% the first 2 months of the pregnancy and 50 to 80% the third month. Therefore, termination of pregnancy is usually recommended with rubella infection. So NHIG option B has been used in the trial for prophylaxis and prevention of congenital rubella syndrome after contact to a case with rubella infection. The results have been discouraging. Therefore, it is not advised for prophylaxis. Option E, rubella containing vaccines are contraindicated. This is again a very important because it is a live vaccine and women who remain susceptible to rubella should receive MMR vaccine postpartum. This is very important. MMR should not be given in pregnancy. It is strictly contraindicated because it is live vaccine. MMR vaccine is a live attenuated vaccine. MMR means measles, mumps, rubella and is contraindicated during pregnancy.